It is that time of year again, and no, I am not talking about the lovely holidays. It is that time of year when it gets dark and it gets cold and the winter blues set in. That's right, I'm talking about seasonal depression, or as it's known, seasonal affective disorder. So in today's video, we're going to be talking about what is seasonal affective disorder, how to tell if you have it, and what you can do about it. So let's jump in. First off, I just want to start off by saying that a lot of people feel a lower mood and a little bit more sad and down and lethargic in the winter months. Not everyone who feels down and low during the winter months suffers from seasonal affective disorder. So what is seasonal depression or seasonal affective disorder? Seasonal affective disorder is where a person experiences the start of or the worsening of depressive symptoms. Usually this happens around the fall or winter months. So why does this happen? Well, let's talk about the science behind that for a little bit. During the winter months, our days get shorter. Nighttime comes sooner and morning can't get here soon enough. So what does that mean for us? Well, that means we get less light. That's right, a light, like sunlight. Sunlight really helps to balance out your circadian rhythm or your internal clock. When you go outside or when you get up in the morning, light comes in through your eyes and it activates into your brain saying, hey, it's daytime, it's awake time. And your brain runs on chemicals. So two main chemicals in your brain that help regulate sleep and wake cycles and your mood are serotonin and melatonin. So serotonin helps regulate your mood and melatonin is what helps you go to sleep. So when you get less light activating your brain, you are getting less serotonin and more melatonin, which means you're less happy and more tired. These kind of symptoms affect everybody, not just people who experience seasonal affective disorder. To have a diagnosis of seasonal affective disorder, you have to meet certain criteria, and it's not actually a diagnosis in and of itself. So for it to actually be said that a person has seasonal affective disorder, you would have to have depressive symptoms that either start or worsen with the season, and it has to be significant enough to meet criteria for a depressive disorder. And also you have to have that pattern, that reoccurrence for at least 2 years. Not only that, but when it's not the season of depression, then you have to not meet criteria for a depressive disorder when it's not during that season. And I say season here because even though we call it winter blues, and it is most often experienced by people during the fall and winter months, it is not unheard of for it to happen during spring and summer for certain persons as well. So I have a whole list of different signs and symptoms of seasonal affective disorder. I'm gonna read them off to you, and while I'm doing that, why don't you go ahead and hit like and subscribe. All right, let's see. Low or sad mood, low energy, being tired and lethargic, irritability, crying episodes, difficulty concentrating, increased sleep, feeling withdrawn or behaving withdrawn, having carbohydrate and sugar cravings, and sometimes weight gain. So those are the signs and symptoms of seasonal affective disorder. It's also pertinent to note here that they vary in a range, way from just kind of sad down, like they said, winter blues, all the way to severely depressed, unable to function, and some people even have inpatient hospital stays because they're that severe. So what can we do about it? Well, I got 4 things that you can look into if you listened to that list and thought, yeah, that's me. One thing that you can do is to get more sunlight. So I know what you're gonna say, Katie, how can I do that? It's dark out sooner, it stays dark longer. When am I supposed to get outside? So yes, going outside would be helpful. If you can, eat your lunch outside, get more light, sit by a window, all of those things. But there's also light therapy or phototherapy. There are some light boxes that you can purchase online, and you can sit in front of the light box, and it's supposed to increase your vitamin D and all those other things and get the light on you. You can do this in the mornings if you're a morning person and you get up and it's still dark out. Spend a few minutes with your light box and help yourself get up and going and your brain wake up those serotonin receptors. You could also do it in the evenings or afternoons when you get home and you're just not ready to go to bed yet. 6, 7 o'clock at night rolls around, it's pitch dark outside, sit in front of your light box for a little bit, and it should help. Another thing is vitamin D. So again, you get vitamin D from the sun and the light, and so you could spend more of your time that you are awake outside and hopefully absorb more vitamin D. You can look into your diet and see where can you consume more vitamin D. You might try supplements or something like that to help increase your vitamin D during the winter months. Another proven and effective therapy is cognitive behavioral therapy, where you would meet with a mental health clinician, learn some stress reducing technique, talk about any kind of problems or things going on in your life. This can be very helpful and has been proven to work. And if you're looking for mental health therapy, I hope you will look to Blue Elephant Counseling, where we do online counseling for residents of Nebraska. There's one more option for you if you are experiencing seasonal affective disorder, and that is medication management. So with any medication regimen, I recommend that you meet with your primary care physician, your regular doctor, or seek a psychiatric evaluation to get a medication management going. However, antidepressants have been proven to be helpful for persons who experience seasonal affective disorder. So thanks for watching this video. If you like the content, again, hit subscribe and stay tuned for the next one. See ya.